Good day, everyone. Today we will be presenting our educational pamphlet on the topic of interdisciplinary approach to patient management, specifically on combined endodontic, orthodontic, and prosthodontic treatment of fractured teeth.
So, what is interdisciplinary dentistry and how is it important in the field of dentistry? To tell you, it is a team based approach where multiple specialists, such as endodontists, orthodontists, and prosthodontists, work together to provide a comprehensive treatment for a patient with complex treatment needs. So here are the steps for successful collaboration. First one is the patient assessment, then the treatment planning, followed by the treatment implementation, and lastly the monitor and evaluation. I guess these terms are just self-explanatory, but let me just give you a run through. So for the patient assessment, from the word itself, assessment, meaning you will be assessing the patient's oral health needs and goals. Then the treatment planning. So you will be developing a customized treatment plan that addresses all aspects of the patient's oral health. And then followed by the implementation of the treatment. So just basically you'll be doing what is planned ahead of time. And lastly, to monitor and evaluate the progress regularly to ensure the treatment plan is effective and any necessary adjustments are made. Now, the key benefits of this approach are as follows. First one is the improved patient outcomes. By combining the expertise from different areas, specialists can provide more effective and tailored treatment plans. And of course, enhance patient care since there will be a multiple possible options from the dental specialist, right? And then also the advancement of dental knowledge. Because working together, specialists can share knowledge and learn from each other. And lastly, improve communication and teamwork. Interdisciplinary dentistry fosters a better communication and teamwork among dental professionals, resulting in a more efficient dental care. So, with the case study shown below, we'll be needing the collaboration of the three dental specialists, namely endodontist, orthodontist, and prosthodontist. Now, what are the differences among the three? And what are their roles in dentistry? So, for endodontists, they focuses more on treating the tooth pulp. On the other hand, orthodontist deals with tooth alignment. And lastly, prosthodontist deals with tooth replacement. So the common problems that these three dental specialists deals with is that endodontist deals with tooth decay, trauma, and infection. So they treat them with root canal therapy as well as apical surgery. On the other hand, orthodontist deals with misaligned teeth, crowded or spaced teeth, and jaw abnormalities. So basically, they'll be giving their patients braces, retainers, or even jaw surgery. And lastly, the prosthodontist, which deals with tooth loss, tooth decay, as well as periodontal diseases. So they are probably responsible for implants, dentures, and crowns. Moving forward, this case study presents a young boy, ages 10 years old, who suffered a dental trauma after a fall. So the injuries included fractures to multiple anterior teeth. Through the radiograph, it was confirmed that there is a presence of fracture in the maxillary left central incisor, as seen on the picture.
A case such as this would need the hands of more than one specialist in order to deliver the best treatment for the patient and ensure a great prognosis as well. The treatments done were as follows. Firstly, root canal therapy was carried out immediately to the maxillary left lateral incisor, and then a root canal filling was performed on the maxillary left central incisor. Calcium hydroxide dressings were then placed in the maxillary right central incisor and left lateral incisor as their apical roots were still incomplete. After that, the left central incisor was then extruded orthodontically, bringing the fracture line above the level of the alveolar bone. Screw post was cemented to the fractured tooth. After completion of the extrusion, a post-core was performed. The tooth was successfully restored with a veneer crown constructed over the post-core. The fractured incisal portion of the right central incisor was restored with a composite resin using the acid etch method. A tooth that would have been extruded routinely was thus saved and restored through the use of collaborative approach.
This case study demonstrates the effectiveness of interdisciplinary collaboration in treating complex dental issues, specifically fractured teeth. So the first one is the preservation of the natural tooth. So it focuses on retaining as much of the fractured tooth as possible, ensuring its long-term function. And second is the improved aesthetics and function. So by replicating the fractured crown, it was crucial not only for the function itself but also for restoring the tooth's appearance as well as the patient's self-esteem. And lastly, the long-term outcome. The well-curated treatment plan involving various specialists such as endodontists, orthodontists, and prosthodontists ensured both immediate relief and positive long-term prognosis.
Prognosis wouldn't have been that great nor favorable if the effort of these three were non-existent. Every phase of this patient's treatment plan was well curated for the benefit of both the patient and even the dentists that are treating the patient. Forced orthodontic treatment is frequently a helpful substitute for extractions or significant periodontal surgery. For fixed prostheses, adjacent teeth do not need to be prepared, and alveolar bone as a result was preserved from potential early resorption. The world as we know it basically runs on the concept of collaboration, so it shouldn't come to a shock that more and more complicated cases are being addressed with an interdisciplinary team. Some other cases we've found that highlight interdisciplinary dentistry are as follows. The first case here concluded that controlling the disease and restoring periodontal health is essential for successful prosthodontic rehabilitation in patients with aggressive periodontitis. Treatment of aggressive periodontitis is often complex and requires an interdisciplinary approach. In this patient, collaboration between the orthodontic and prosthodontic treatment. The aesthetics were improved by using a fixed bridge as her definitive treatment. The second one concluded that better understanding of the tissue behavior and broader treatment modalities helped in discovering for situations which were otherwise deemed to be impossible before. With the advancement in the interdisciplinary treatment approaches, aesthetics can be improved through adult orthodontics even in patients with reduced periodontal support, under strict periodontal invigilation and monitoring. That would be all for our presentation today. This was presented to you by Christine Cabusas and Justin Duga. Thank you for your time and have a great day.